This is the circular electrode to map the left atrium for the pulmonary veins for ablation. Yeah, the ACT is done every 20 minutes and try to maintain the ACT to more than 300.
So lower threshold 5 grams, sir. Higher threshold 30 using.
So 3D sensor is being used. Just now the rhythm is of atrial fibrillation, and once the ablation is done, you will be able to see the conversion of the atrial fibrillation to sinus rhythm on table. So this is the mapping being done, both with a 3D sensor and a 3D mapping to look at the pulmonary veins and then ablate the pulmonary veins. This is the left atrium. The angiogram is being made in the LA to look at the pulmonary veins so that we know whether they are suitable for ablation. So these are the various shoots. This is the left upper cardiac vein for which the ablation will be needed. This is the right pulmonary vein, and delineation of these veins are important with a 3D mapping for ablation. This is the right inferior pulmonary vein. The right superior, right inferior, left superior and left inferior pulmonary veins are all being targeted for ablation. So this is the maneuvering of the catheter to look at the pulmonary veins and decide which are the pulmonary veins by 3D mapping for ablation.
Next to it, next to the markers.
So just now he is sensing all the atrial fibrillation foci with this triage catheter, trick catheter. It's like a bomb detector, to see where the left atrium has got sensors, and then 3D mapping is done of the sensors, and then all the dots are being put so that you know from where the atrial fibrillation is originating in the left atrium. And then he will map that and then use radio frequency ablation for those